Hello everyone, here my speak today is about the risk factors for post-operative recurrence of the Crohn's disease. We have different risk factors for the recurrence of the Crohn's disease post-operatively, some of them related to the patients and some related to the disease and some related to the surgery. If we look to the post-operative risk factors related to the patients, we are knowing that the active smoking, younger age of the disease onset, and family history of inflammatory bowel disease, past or current extraintestinal manifestation of the IPD genetic factor in some cases, not two. As I mentioned before, card 15 mutations. It is one of the factors which carry bad prognosis for recurrence or post-operative intestinal microbiota. All of the world speak today about the effect of microbiota in the recurrence of the Crohn's activity post-surgical intervention. Related to the disease, ileal or ileoclonic disease location have a higher recurrence more than the clonic one or upper GI. Penetrating disease pattern or preanal disease, extensive intestinal involvement or extensive resection of the colon or the small bowel. All of these are a risk factor for the recurrence and related to the disease itself. Previous bowel resection, this is the second time for the resection. This also carry some sort of bad prognosis or recurrence of the disease activity and high titer of antibody against the Saccharomyces cerevisiae, which it is one of the of bacteria which involve in the occurrence of the inflammatory bowel disease. The granuloma present in the resection of the specimen and severe meningitic plexus affection or inflammation in the specimen. This all related to the disease and related to the surgery. If there is an acona S-type anastomosis are used in this, and this is known by all surgeons. If they use this type of the anastomosis, they may be having a recurrence of the activity post-operative. Many thanks and welcome.